Vitamin D, mainly known as calciferol, it is a fat-soluble vitamin, and as we mentioned in the previous video, what does fat-soluble vitamin mean? That it tends to accumulate and so on. It can be produced either by our bodies, and also it can be consumed from the diet, mainly from the fatty fish such as the salmon, the sardine. It can also be consumed from eggs or from fortified foods such as some fat spreads and breakfast cereals. In addition, as we all here, sit in the sun to get some vitamin D. Now, is this true? Yes, it is true. You can get vitamin D by sitting in the sun. Your body makes vitamin D when direct sunlight. It helps converting a chemical in your skin into an active form of the vitamin D. This applies in summer. However, in winter months, usually not enough vitamin D is presented, obviously, because there's not enough sunlight. So during the autumn and winter, you might need to get the vitamin D from your diet because the sun is not strong enough for the body to make vitamin D. However, make sure to not sit for a long time in the sunlight and get burned, as too much sun may damage the skin. All people are advised to use sunscreen, as it is important to prevent skin cancer and skin aging due to exposure to sunlight. However, sunscreen can actually decrease the vitamin D production as well. Now, why is vitamin D important? Vitamin D helps regulate the amount of calcium and phosphate in the body by absorbing and maintaining them. These nutrients are needed to keep bones, teeth, and muscles healthy. A lack of vitamin D can lead to bone deformities such as rickets in children, which is bone deformities as the picture is showing, and also a lack of vitamin D may lead to bone problems such as osteomalacia. Also, we see many times that vitamin D is co-administered with calcium in osteoporosis, and we're going to explain later why. And even vitamin D can be used in kidney problems such as the CKD, which is the chronic kidney disease, because in this condition, the kidneys, we will be having problems in the kidney, and as we know that kidney is responsible to convert vitamin D into the active form, as we're going to see later. So if we're having a problem in the kidney, we will not be able to convert the vitamin D into its active form. Now, what is the linkage between calcium, vitamin D in osteoporosis? Well, that's because our body can absorb calcium, which is the primary component of the bone, only when vitamin D is presented. That is why they are used concomitantly. So in order to be able to absorb calcium enough, we need vitamin D to be presented. Vitamin D also regulates many other cellular functions in the body. It has an anti-inflammatory, antioxidant, neuroprotective properties. It supports the immune health, muscle function, and brain cell activity. Just on a side note, that many of us heard about vitamin D supplements maybe. However, there's some conditions that actually vitamin D is given as injections, and also you might see vitamin D as droppers for those infants and children in order to be able to administer vitamin D. So let's check how vitamin D is transformed into the active form in our body, and what does this have to do with the kidney and the liver. So as we're seeing, we have the exogenous intake of the vitamin D, which is the cholecalciferol, and it's usually from the diet. And we have the endogenous synthesis, which is the synthesis of vitamin D through exposure to sunlight, which will transform the 7-dehydrocholesterol into the vitamin D3, which is the cholecalciferol. Now, in order to be activated into the active form, it requires 2 hydroxylation reactions in the body for activation. The first hydroxylation, which occurs in the liver, and it converts the vitamin D to the 25-hydroxy vitamin D, which means that the carbon on the position 25 in the chemical structure needs to be hydroxylated, which means an OH is added, and it will be transformed into the calcidiol, and this requires the liver to undergo this hydroxylation. And the second hydroxylation, which is done through the kidney, and it will be transforming the calcidiol or the 25-hydroxy vitamin D into the calcitriol, which is the 1,25-hydroxy vitamin D. 125, which means that on the position number 1 and 25 in the chemical structure, we will be having an OH or hydroxylation. And also, as we're seeing that there is many medications that are administered as calcitriol. Now, why do I need to give the patient calcitriol directly and not cholecalciferol or calcidiol? Now, mainly if someone have a problem in the liver, he have a liver impairment, he is not able to do hydroxylation in the liver, so we might consider giving this patient a calcidiol, which is an already activated or already hydroxylated by the liver vitamin D. So we can consider administering it to the patients who have liver problems and give them the direct hydroxylated form, and then it will require also hydroxylation by the kidney into the active form. Now, what if a patient have a problem in the kidney? So we'll need to give him directly the calcitriol because his kidney will not be able to work properly and will not be able to transform the calcidiol into a calcitriol because there's a problem in the kidney, and thus we give them directly the calcitriol. So to recap, if someone have a liver impairment or a problem in the liver, we can directly give them the calcidiol, which is the already hydroxylated. It does not require hydroxylation by the liver, and then it will be hydroxylated by the kidney into calcitriol. And if someone have a problem in the kidney, we will directly give him the calcitriol in order not to undergo the activation through the kidney from calcidiol and calcitriol because there is a problem in the kidney. Now, usually you might hear about two forms of vitamin D. We have the vitamin D2, which is also called the ergocalciferol or the pre-vitamin D, and it's usually produced in plants and fungi, and the vitamin D3, which is the cholecalciferol, which is produced in animals and in humans, which means I can get it from the sunlight. And knowing that these two only differ chemically and they only differ in their side chain structures. Now, which people are at risk of developing vitamin D deficiency, or they might be deficient in vitamin D? Some people will not make enough vitamin D from the sunlight because they have very little or no sunshine exposure, maybe because of staying indoors or even the country they live in where the sunlight is limited. In addition, if you have dark skin, for example, you are African, you may also not make enough vitamin D from the sunlight. Now, why do dark skin people can get enough vitamin D from the sunlight? Because black people usually have high melanin levels, and this melanin is responsible to give them their black skin color. So the more melanin it is, the more darker the skin color. Also, melanin has a job in protecting our skin against the UV sun rays, and thus it will affect the vitamin D production. So, as a black person with so much melanin, he will not be getting enough vitamin D. Why? Because this melanin will be acting as a shade, and as I mentioned, melanin has a protective against the UV sun rays, so not enough sun rays will be absorbed through the skin of black people, and because they have so much melanin, not enough vitamin D will be produced, and they will also have a reduced production of the vitamin D. So that's why dark-skinned people need to get it from the diet, need to get supplementation at some times, because they have high levels of melanin and they are not able to absorb vitamin D to a high level. However, this having a high melanin level is something which has advantages. It reduces the damaging effect on the sunlight on the skin, including skin cancer, because as I mentioned, melanin has a role. It acts as a shade, so it protects against the sun rays. And at last, of course, it's advised for infants, young children, pregnant women, and lactating to have vitamin D supplementations. Now, what happens if you take too much vitamin D? Taking too much vitamin D supplements over a long period of time can cause too much calcium to build up in the body, causing hypercalcemia, which can weaken the bone, damage the kidneys, and the heart, because as we know, that vitamin D will be causing more absorption of the calcium, and thus more calcium, which affect the heart rhythm, and also too much calcium can build up in the kidney, causing stones and other problems. Although you cannot overdose on vitamin D through exposure to sunlight, but always remember to cover up or protect your skin if you're out in the sun for long periods, to reduce the risk of skin damage and skin cancer, and also skin aging, which comes from the sunlight. So that's why you need to put sunscreen on, although it decreases the production of vitamin D. So what are the signs of symptoms of taking too much vitamin D? Nausea, vomiting, poor appetite, weight loss, constipation, weakness, confusion, disorientation, heart rhythm problems, kidney stones, and kidney damage. This was all about vitamin D, and make sure to check other vitamins, and I'll see you in the next video.